Hello and welcome everyone. I'm Dr. Ariana. Welcome to another episode of the Stage You See podcast. It's February. February is the month of love, and we're going to be talking about all things love. We're going to start out with some sex and intimacy. And although sex doesn't necessarily have to deal with love, intimacy, connection, we're going to be talking about how we really kind of bring that back to our relationships as we first and foremost understand what's happening to our bodies as we change. And these are all things that I've spoken about before. This is just another offshoot of what I called our Cupid's Playground, which occurred on February 6th. It was a live webinar where people were able to ask questions. But in case you missed it, I am going to be, again, speaking on the anatomy of what I would consider sex and intimacy. So first and foremost, we're going to deal with understanding our anatomy, and then we're going to understand some of the differences that happen between men and women and how men and women change. Men are going through andropause, meaning their testosterone levels are declining, and women are going through menopause, meaning they are ending their reproductive years. Interestingly enough, men almost never end their reproductive years, but they do have a decline in testosterone, which affects them fairly significantly for some men. And a lot of men, whether it's the stress, whether it's exposure to certain chemicals in the environment, lifestyle, their testosterone levels are actually low and they're having lots of symptoms. And these symptoms can collide at the same time as you are going through the menopause. So you might notice that your partner is more grumpy, tired, fatigued, less libido, less motivation in general, getting a little pot belly. And yes, these are hormonal changes that also happen to men. And this can be really devastating for a relationship when the man is going through these things, the woman is going through these things. And of course, I'm going to be speaking in terms of heterosexual relationships. I understand and respect, appreciate all shapes, colors, sizes, flavors, but I'm going to be speaking in generic terms in terms of those that own vaginas and those that own penises, but we're going to be referring to them as men and women for today. So yeah, we have a lot to get into. But before I do that, I want to share a little bit of reflection with you. And since it is the month of February, and February is the month of love, I am reading from the book here, How to Be Loving by Danielle Laporte. I've been reading this book now for probably over a year. I go back into it. I've read most of it, but this is a perfect book to just come back to when you're just needing to get a little boost for your spirit. I also listen to it on audio because I just love her voice and I love her message, which is really about learning to truly tap into the love for yourself. So I'm going to read from the book a chapter entitled Reflecting. In order to see the whole picture and everything in it, we have to slow down. We have to be still to actually reflect on what's happening and what might be true or false about what's happening. Reflection is a heart practice. Stillness and contemplation are how we tap the vitality of the heart, which is limitless. When we live more reflectively, we operate less reactively. With every meditation or earnest question, with each honest prayer, given blessing, or intimate conversation that we have with ourselves or each other, the heart is giving us confirmation about how massively beautiful life really is. The heart will always choose to focus on what's working. But many of us aren't raised to live very reflective lives, and our productivity-obsessed culture won't have any of it. Instead of reflection, receptivity, and responsiveness, we tie ourselves to a looping track of reactiveness. And then we mostly sleepwalk through the days, inevitably getting hammered by some kind of painful occurrence. And then we wake up to a glimpse of a higher purpose. And if we don't dedicate our lives to that higher purpose, to love, then we'll probably doze off until the next bout of hard-to-bear discomfort or loss arrives. We think we're really smart with our strategies for status and self-preservation, but running from love while looking out for number one is a high form of foolishness, because unconditional love is what we really want the most. Regardless of our status, and no matter how many degrees, followers, or pretty things we own. No matter how much we've accomplished or overcome in the material world, what we yearn for is to rest in love. We want to relax into the great heart, the heart that holds us all, and to feel creation carrying us. It's the freedom of union. It's the liberation of belonging to each other. There are ways to get free from the madness of the world we've made and to be at ease. There are metaphysical, superconscious, ancient, and scientifically proven ways. Mindful breathing, visualization and meditation, acts of kindness, community building, forgiving each other, getting good sleep, healthy eating, joyful movement, loving who we love, full on and full out, and then including ourselves and all beings in that love. So that is some words from Miss Danielle Laporte. I love her work, and if you have not checked her out, I highly recommend. She's got a lot of great things. She even has a planner that really allows you to plan not only just your life and your day-to-day, but not around like your to-do list, but really your nurturing, like what's going to nurture your soul this week, or how are you going to love yourself or others? And so it really just reminds you to do that part of your to-do list as opposed to just the grind. All right, guys, have you ever wondered how your anatomy actually influences your pleasure, or why emotional connection is just as important as physical attraction? Today, we are going to explore all of that and more. And don't worry, this is a judgment-free space. Just sit back. I want you to just understand anatomy first and foremost, and then we're going to dive a little bit deeper into how that relates into the anatomy of actual intimacy. So let's break that down. So, I have my old friend here. She's my girl. I should probably give her a name. Yeah, that's for another time. But if y'all have any suggestions, let me know what we should name her. This is our friend, the clitoris. Remember, she's got kind of this central area here, the head, so to speak. This is the glands, technically speaking, from a medical terminology. And these are crura. These are actually extensions of the clitoris. But the part that we actually see is just this little area here. But she's so much more. She wraps around the vaginal opening. And so if you can imagine, if you're listening, I want you to kind of think of a wishbone, right? So the wishbone kind of has that arc area where it comes down. Think of having two legs on each side of the wishbone. And this clitoris is going to wrap around the vaginal canal. And this small but mighty organ actually has about 8,000 nerve fibers and nerve endings, I should say. And that is twice the amount of the penis, just saying. Now, you should know that the clitoris is analogous to the penis. And what happens is that when the penis is aroused, or the person is aroused, the penis will have increase in blood supply, and that increase in blood supply is going to cause an erection. Well, women also basically have erections. We have the same kind of phenomena that's happening. We have increased blood supply that goes to this organ. It's going to expand. Nobody knows exactly how big this girl gets, but she grows. She takes up some more real estate. And what we also are probably coming to understand a little bit better is that the kind of the confluence, the connection, this is like a network. You think of this as a clitoral network, but the G-spot, where we are assuming the G-spot is really probably somewhere at this connection where the glands and the head area comes into contact with both of these crura, these arms and legs that are kind of extending off. It's kind of sad that we don't understand the clitoris as well as we could. The clitoris, as I've mentioned before, it really wasn't until the late 20th century with the Dr. Helen O'Connell, who really was the first person to map the internal structure of the clitoris with modern imaging, with the MRI. And so I think I want to say it was 2004. Whenever it wasn't that long ago. And it's really ridiculous because really in ancient medical texts, the clitoris was literally ignored because nobody really understood it, and they kind of just dismissed it as being very insignificant. And then, things kind of progressed during the Renaissance. There are different anatomists who basically started documenting it, but they really still didn't quite understand exactly what it was doing and how it was working. And despite all of this, I think I've described this in another podcast. It's like even anatomy books, up until even the anatomy book, I went back and looked at my anatomy book from 1987, and I didn't see a clitoris. There was like no clitoris in there. I was like, wow, they really like just didn't exist. So I think we're finally starting to realize that female health, anatomy, all the things that so much has been neglected. And we are just now starting to figure some things out. So you're not alone if you're feeling kind of ignorant about some things. But I do want you to always understand how this clitoris works, because I think that's a really good part of understanding your overall, sexual anatomy. And if you don't really understand how that works, then I think then it becomes a little more obscure. But if you can kind of put this in context and how that expands during arousal, then I think it just makes it a little bit easier to understand where those little areas could be. Male anatomy is a little bit more straightforward. And we know there's the penis, the scrotum, and the prostate, and all kind of works together to create arousal and pleasure for men. But erections for men aren't just about desire. There actually has to be adequate blood flow. There has to be adequate nerve stimulation, and also their hormones play a role as well. So imagine going through menopause, perimenopause, your estrogen levels are falling, his testosterone levels are falling. Neither one of you are probably having the same libido. Neither one of you may be having the same level of arousal. It can be kind of frustrating if neither one of you know what's going on and you're not really that couple that's having those conversations. So the first thing I'm always going to say is that you got to start having these conversations. And, for some couples, these can be challenging conversations because, we've kind of just taken for granted. We're just going to have sex and this is how it's going to work and everything's going to be fine. But as we get older, you kind of need to understand things a little bit better and be able to communicate, because things just don't be working the same way. They don't be happening the same way. Funny story, true story. I was talking to a friend yesterday, and I would say, I was a little envious of her because oftentimes when we would talk, she was just very, very vocal about her sex life with her husband. Like they basically were having sex, like every day. And I was like, wow, okay. Like almost to the point where I was just like, I knew I wasn't crazy or abnormal because I have patients and I know they're not having sex every day. Like I know the average woman that comes into my office is not having sex every day. But so she was definitely an outlier, a good outlier, again, right? It's a bell curve, I'm sure. There's no right or wrong or number of times that you should be doing it. It really, at the end of the day, is going to depend on that couple and what each person wants, right? Because if y'all want to have sex once a month, great. You want to have sex every 3 months, great. There's no right or wrong with that. But she was having sex every day. And recently, her husband's gone through some medical challenges. She's gone through some medical challenges. And she says to me, girl, I haven't had sex since October. And I was like, what? Like, what is happening? Because something is going on, because that's abnormal for you. But it just reminded me that, couples were going to go through some of those lags and lulls. Sometimes I reminded my husband's like, we haven't had sex in like a month. No, it hasn't been that long. Yeah, it has. It's been that long. And so it's okay. Again, there's nothing wrong with it. I think we are kind of taught or we're influenced to think that somehow we're just supposed to do this thing on some type of recurring basis. And if you're not doing that, then something's not right. But whatever it is that you feel comfortable with. So the first thing that I really do want to leave you with is being comfortable with whatever it is you're comfortable with. And if you and your partner are both comfortable with what that is, then that's perfect for you. It's not about what other couples are doing. Oh, yeah, I just wouldn't even want to have sex every day. That just makes me tired thinking about it. But so anywho, I digress as usual. I was talking about the penis and scrotum and the prostate working together and pleasure and arousal, and basically how the male anatomy, the female anatomy they're analogous. Like the clitoris and the penis pretty much do the same thing, except the clitoris is hidden. She's demure. She's less obvious, right? And so when women are aroused, it's going to show through lubrication, through getting wet, so to speak. But those are things that aren't as obvious as obviously an erection. That said, there are 4 stages of this sex response cycle. And what's important to understand about the sex response cycle is that men and women go through these stages at different times, at different speeds. Right. And the most important one is that excitement stage. That excitement stage is when there's going to be increased blood flow, more arousal. That's when women are going to be lubricated. Women might be lubricated. Men are going to have an erection. That said, men, excitement phase goes way up real fast. Women, we don't go so fast. We go much slower. And we kind of have to build. it builds and it builds. And so this is where there can be a disconnect with couples because, you're tired, you're trying to get through the rest of your day, or morning or whatever it is, time that you're doing what you do. And it takes time, right? And so for a lot of women, first and foremost, we got to get out of our head. That takes, that could take a substantial amount of time. For some of us, I will speak for myself. And then after getting out of our head, then we have to kind of get into that excitement stage. But I can't get excited until I just like put down the rest of the day. And this is why, our stress levels, cortisol, all of these things impact our ability really to even experience pleasure. With that said, that first excitement stage of the sexual response for men is going to go much faster. For women, it's going to go much slower. But we're both trying to get to that same point, which is really this plateau point where there's this heightened sensation, where there's the tension that builds that ultimately is going to result in climax or orgasm. And so those two stages that lead up to the orgasm or climax, again, for women goes much slower. That's why the old adage of, I would tell my husband, you got to start making love to me like in the morning, like say nice things, do something. Make me want it. Like maybe at least start thinking about it because I can't get there as quick. If you start earlier, then maybe we can meet up at the same time, but we can't just start and then we're not going to meet up so quickly. And I don't want you to be frustrated, but it's going to take a minute. It's going to take a minute. So understanding that we're just wired differently. We just are wired differently. And that women just really do much better in general with like respecting this two phases of excitement and plateau for this arousal. And then ideally or not, it doesn't have to happen because intimacy does not have to involve orgasm or climax. But if it does, orgasm will occur. And then after that phase is called the resolution phase. That's when, that's when the oxytocin kind of finishes releasing and there's that emotional bonding, especially for women, can be also for men, of course. But that's where, we get our feels. And that's when, that's really what kind of can also set things off and really add to that intimacy for women in particular. So, but did you know that your brain is the most powerful, the largest sex organ? Because without the ability to imagine, without the ability to have that mental stimulation, and it's kind of hard to make the rest of it go. So arousal just isn't about the physical; it's about also the psychological. So I'm going to break that down. There are sensory triggers, there are psychological triggers, and then there's just good old communication. So those sensory triggers are going to be like, you're smelling that cologne. Oh, you're looking at those shoulders. There's just something, and you see it. You feel it, you smell it, you touch it, all of the things. And the psychological triggers are going to be more along the lines of how emotionally secure, how safe you feel in that relationship, the confidence you have even with your body in that relationship. And that's a really important part, especially for women, because body image really, unfortunately, tends to play a bigger role. I mean, the fact that it plays any role is unfortunate, but it can play a big role in women's desire because when they don't feel like they love their bodies, when they don't feel confident about their bodies, then that really can inhibit their ability to experience pleasure. So I've had a lot of patients that tell me, that's part of it. It's that I don't like my body. And so they can't really just get past that, which I would say, I haven't surveyed all of them, but the types of things that women don't like about their body are generally, we're not talking about 500-pound women that, have probably some reason to have some question of confidence around how their body image is, because that's just how society has kind of just created us. But we're talking about average women, average woman is going to have cellulite. The average woman is going to have, something to grab. When I talk to the average partner of that average woman, they're like, they don't even care. Like they're not even thinking about it. They really aren't, but we are so much in our head. But this is a psychological trigger. And so maybe it's also mental stimulation that can occur to trigger you. But my point is that it can also like untrigger you, meaning that psychological trigger can make you not have the libido or not want to have sex. And then communication is another part when we talk about the science of arousal and emotional connection. Couples ultimately who are able to have these conversations are going to have more intimacy or deeper intimacy in the end. And this is where we got to probably do more work, because sometimes, those communication times come at time of frustration. Right? It may come at a time when you've been thinking something for a while, like, I wish you wouldn't touch me this way. I wish this, I wish that. And then you say it, but maybe you're not saying it in its most loving way, or in a way that it can be as well received. So we got to make time and space to have these conversations in a way so that nobody feels like they're being attacked. Nobody feels like they're just like, wait, what? Where is this coming from? So creating a space that's normal so that you can talk about it. Because let's face it, you weren't taught how to do this. We weren't taught intimacy. And we kind of take for granted that we all understand how this works, but sometimes it's not a bad idea to just get a little bit of, coaching. You can create more intimacy, deeper intimacy with this type of communication. And let's figure out those ways when that communication feels safe. It feels like, something that both partners are engaged in and willing to have. And without some of those things, I think, again, for women, intimacy becomes a little more challenging, because we tend to be a little bit more triggered, so to speak. And that almost goes back to this whole stages of arousal and excitement. It's like that excitement and plateau stage. There's so many things that got to go through our heads first before we can even get to the good stuff. But we got to pay attention to that. And we need to honor that and not feel ashamed. All of us watch television, and television is the worst thing that you can look at to try to identify with your sex life and your intimacy, because that is just so not real in any way. Like, there's this idea that you're just going to go in a bathroom in some random restaurant and just, get up on a sink, and it's like, no, like, that's just, generally speaking, that's not how this happens. Now, I know that happens. Okay. But I'm talking about the rest of us average folks. So we're going to talk about menopause and intimacy and andropause and intimacy. So with menopause, estrogen levels are going to decline. What's that going to do? You know the story: vaginal dryness, maybe some pain with intercourse. But what's actually happening is that the tissue itself is thinning. Estrogen also is important for your libido. So oftentimes we think that testosterone is the libido hormone, but estrogen is really very important. I have treated many a women who've had a decreased libido and put them on hormone therapy, and, they come back and they're like, yeah, my libido's back. They don't even need or feel like, they desire any testosterone. So, but think about it. The tissue actually thins. We go from having a very thick vaginal mucosa to literally it thinning. And that is really where a lot of the pain can come from, because we don't have that same kind of, the medical term is the rugae. So they're like almost little folds. And so between the lubrication and all the folds and all that, everything is just, it's like a nice cushion. But think about it like a mattress or something that just flattens out. And so now that friction isn't feeling the same way. It's not hitting the same way. It's thin. The tissue actually can tear. Oftentimes there's going to be some potential bleeding with intercourse. This is when things really kind of start to go sideways. And that part, first of all, is totally unnecessary, because the number one thing you can do to fix that is vaginal estrogen, which is 1,000% safe. Even if you are a breast cancer survivor, I will say that again. There's a new study that came out a few months ago where they actually treated breast cancer survivors with estrogen vaginally, and there was no increased risk of recurrence of cancer. And I'll share that with you all probably in another podcast, because I'm really going to get into vaginal estrogen and how important and safe it is for those of you who are just terrified of anything estrogen. Unfortunately, you've been brainwashed. I don't know any other way to say it. You've been fed a lie. And estrogen, especially in your vagina, is probably one of the best things you can do for yourself to keep the moisture, to keep the texture, and to allow for the blood supply and the nervous supply to continue. Just like with men, think about it. Men get erectile dysfunction. The number one reason is beginning to have a decrease of blood supply to the organ. So you think about your brain, you think about your heart, your kidneys, your clitoris, your penis, your legs, your feet. As we get older, we start to develop little plaques in our blood vessels, right? So those plaques, they're micro plaques, and they don't generally often plug up the big vessels. It's the tiny, tiny, tiny little vessels. And so what happens is that over time, we get less and less blood supply. This is why men in particular who, for example, either take hypertensive drugs or are hypertensive, over time, there's what we call small vessel disease. And all of that extends everywhere, extends to the brain, the heart, the kidneys, the penis. And so erectile dysfunction can occur. So your lifestyle, your weight, your eating habits, all of that can affect erectile function for men, but it also affects it for women. So true story, I started doing a procedure in the office, several years ago. It's called extracorporeal shockwave therapy. This is a therapy that really started in Europe. It's been very popular, and it's kind of popular here, but not as much, I think. But basically, I liken it to like a little mini jackhammer. The machine we have in the office is called a Zimmer, but literally it's extracorporeal, so out of the body, shockwave therapy. So it just kind of pounds it out. And so what that does is it breaks up those little plaques. So we use this treatment to treat erectile dysfunction. And I must say, for the appropriate patient, it works very well. And so men, for example, who don't want to use Cialis or the Viagras of the world, because they kind of have to take it, and then, you never know what's going to happen, but you take it just in case. Side effects, they don't like that. And they want the spontaneity. I started doing this treatment. And then after doing it for a few months, I was like, well, if it works for men, why wouldn't it work for women? So I started doing it on women. We now call it the Tula wave in the office. And basically, I kind of created my own little protocol because, our anatomy is very similar. So we treat around the clitoris, we treat around the crura of the clitoris, and then we treat in the perineum. We also even treat in these iliac arteries. We start with the blood supply, the main blood supply that actually is starting to go to the sex organ, the clitoris or the penis. And lo and behold, it actually worked. So yes, there is a psychological component, there's a hormonal component, but understand that our bodies are actually changing in the sense that we are having less sensitivity because as we are aging, we're having less blood supply to our organs. And there are things that we can do to wake all that up. So yeah, you can give someone testosterone. That's going to help potentially with a man that has erectile dysfunction. But if he has pretty significant kind of in-organ disease, that's why a Cialis or a Viagra might help, because those drugs in and of themselves are going to vasodilate. They're going to basically help to push that blood through, even under the circumstances of these microplaques, which we would call in the tissue. The Tula wave is a thing. Extracorporeal shockwave therapy is a thing. It doesn't hurt. Typically, it's about 6 treatments, and the results are fairly quick, and they're going to last probably a good 6 months to a year, just depending on the person. It actually should last a little bit longer because in the end, they're also stimulating collagen, and that process in and of itself is going to really peak at around 3 months. So I can't say exactly how long it lasts. Most people are going to come in for a touch-up probably in about a year's time. But that said, as men are going through this andropause, it's not just the hormones that are changing, it's the blood supply to the organ that's changing. And also, how does that affect intimacy? Men are going to feel less confident. They might emotionally withdraw because they just, society hasn't really made it okay for men to be able to have these open conversations. They'll sometimes have those conversations with their doctors. A lot of doctors, unfortunately, just like with menopause, a lot of doctors for men don't understand testosterone, but testosterone can be it changes lives. It can really change a man's life. So I would say if you have a loved one and he's having some of these symptoms, you really want to encourage him to get his testosterone checked, but not just with anybody. You really need it to be checked with a provider that treats men and uses testosterone. Because I've had several patients that come in and their primary care doctor just won't give them testosterone. They don't understand it. And the reason is because we weren't taught how to deliver testosterone, in traditional medical training. So I digress, but hopefully that will be a benefit for some relationships, because I know that there are couples. I have women very often tell me, it's like, yeah, I know, I'm sure my husband has, low T because I can see, all of these things, but he won't get checked. And so how to have those conversations, I wish I had the magic bullet, but I would say, go slowly, maybe just give information in a way that, they can maybe come to these conclusions on their own, and just trying to reassure our partners that it's okay, it's normal. You're changing, I'm changing, we're changing together. We can laugh at it. That's what my friend actually was telling me. They're cracking up that look at us, like, this is happening to me, this is happening to you. And you have to have a sense of humor about the fact that we are aging, our bodies are different, and our routines are going to be a little bit different. I remember my husband telling me, you didn't need all of this when, we first started dating. And I was like, well, first of all, that was like 30 years ago. And I was a little different back then. And, just the whole honeymoon, the whole dating, all of that's a whole different animal. I've been married 25 years now. So it's like, no, we gotta mix something else up here because that's just what needs to happen. Anywho's, navigating this together as a couple, ultimately is going to help strengthen your bond. I would encourage you to just try to broach those conversations. And, at the end of the day, information is power. And at least sharing with your partners, your concerns, not just from a sex standpoint, but just overall health. And so kind of also redefining intimacy beyond intercourse. It's not about the intercourse, but it is about just even being able to have that sensuality, to be able to have that touch, to be able to have that emotional connection. It's funny, I tell my husband, I have a little code for him, and I walk and he'll be in his office, of course, because he works too much, and he'll just go sit at his desk forever. And then I'll just be sitting in the bedroom, and then I'll go in and I'll say, hey, honey, I want to cuddle. But I really do just want to cuddle. I don't know if I want to have sex. I do know I want to cuddle. And maybe I'll fall asleep. Maybe you'll say something, do something, or I'll feel something and it'll go there. I don't know what's going to happen, but I do want to cuddle. But in his mind, when I say I want to cuddle, he's like, oh, okay, all right. Get up from his desk. And I'm just like, okay, but I can't, like, don't make it pressure. Like, I just want intimacy. And from that, we're going to find out what happens. So just start with the intimacy, start with the time together, start with the touch, start with just being close. And maybe that is the beginning. If you're kind of starting to feel like there's a fade or a separation away, try to bring that back together. Understand that your partner might be struggling himself. And assuming that mostly women are listening to this, your partner, is having its own insecurities about this and maybe doesn't know how to talk about it, maybe feels shame, embarrassment, confusion, especially for men who are, tend to be more virile and just, very much identified with that, and to recognize that this is no longer something that really defines them the same way. It can be kind of jarring, I imagine. So just be gentle and understand that both of us need to be gentle with each other. So the next thing I want to do is bust some myths about all of this. I kind of hit on some of them. One myth is that men are always ready for sex. Desire is going to fluctuate with men just like it fluctuates with women. And especially as we start going through these hormonal changes as we are aging, that's going to change. So I would say that's a myth. Women don't enjoy sex as much as men. That's definitely a myth. But I think people believe that a little bit more. It's just because of the overall society's allowing us to express how much we enjoy sex or pleasure or the intimacy. And again, let's not get confused. Let's not get the sex confused with the intimacy, because you cannot be having any sex, but you can have all the intimacy in the world. But women in general, we require more emotional engagement. That's just pretty much a universal thing. I mean, there are definitely some outliers, but the average woman, I would say on the bell curve, generally needs a little more emotional engagement. We have a whole new generation of women that I'm like, oh, wow, just listening to the conversations of these 20-plus-year-old girls and how they approach their sex, which, first of all, I think it's amazing because they just have so much more freedom and ownership. It's kind of like the song that came out, the WAP, the song, Wet Ass Pussy. That's what the song was called. And, for us older folks, we're just like, whoa, but that was an anthem of, female sexual empowerment. And I'm not in that generation, I will add, but I think it's great as long as we are safe and we are not believing other myths that aren't true about our own sexuality. But if it feels good to you and you're safe, and do you, boo, do you. But women do experience pleasure differently, I would say on average, than men, but not less. And then the last myth is that sex is less satisfying as we age. That is 1000% a myth. And I guess what I would really want to leave you with is understanding that you can rekindle a really good sex life. It's very, very possible, but it does require work, right? It is not one of those things that is just going to pop up and you're just going to fall into. If that's what you want, you got to do the work. That first work, I can't stress it enough, is understanding your own body. And I believe that work really involves pleasuring yourself so you can really understand what is pleasure for you. And once you're able to do that, figuring out ways to communicate with your partner so that you can kind of parlay what you understand into what they understand into what you all both can understand and appreciate, and know that there's no right or wrong. There's no timing that needs to happen. Whatever you do, however you create that bond, that intimacy with your partner, if that's normal for you, if that's healthy for you, then you do that. But as you get older, it doesn't mean it has to get less. I had one patient who I was talking to this about. She was just about to turn 50, and I was asking her about her sex life and how things are going. She was like, "Oh, I don't want to bother with that anymore." And I was like, "Say what? What do you mean you don't bother with that anymore? Like, you're 50. I mean, no, this does not have to go down here. I'm going to tell you from a personal experience. I feel like I'm having some of the best sex of my life now, mainly because I understand my body even better. It's just really letting go of those insecurities about your body. Obviously, it's really important to have a partner that you can work with. And don't get me wrong, like, it's not always easy, but it's very doable. And the things that can help in terms of your satisfaction is considering some of the treatments, considering menopause therapy, the estrogen, maybe testosterone. Testosterone can be huge in terms of libido. Let me tell you, the one form of testosterone that I can tell you that will very likely increase your libido are pellets. Now, pellets are very controversial, and I understand why they're controversial. And what are pellets? Pellets are just a different way for you to get a drug. It's not just hormones. There are other drugs that they can insert. And basically what we do, we take a little blade, we make a small little incision, this little big on your backside, just enough to get the instrument through. The instrument is about this, the trocar is maybe about this size. And then we put the pellet in the trocar, and then we insert it in, and then we take another little tool, we kind of push the pellet all the way in, we pull all of it out, and then we just put a piece of tape on top and cover it up. That pellet will last on average about 3 months, 3 to 4 months. And what is different about this way of getting testosterone is that you're going to start at a lower, you're going to peak, and then you're going to start to come down. As opposed to testosterone that you would take every single day, like through a troche or a cream, your levels are going to probably be a little bit more steady state. But either way, you're going to have peaks and valleys, no matter how you take your testosterone, because you're going to peak every morning. If you take it that way, you're going to peak, in a few weeks and then come down. For men, if they do injections, once a week or twice a week, you're always going to get that peak and fall. So that's oftentimes where the symptoms come in. But pellets in general are going to give you a fair amount of testosterone. And that's a whole conversation of how much testosterone is too much testosterone. I will tell you that, years ago, I poo-pooed the pellets because conventional medicine does not like pellets. And I think there's just been some bad players or some people that put in pellets. And then what does happen with a pellet is, I call it, you get your first testosterone high. And that first testosterone high is a very good high. I tell you, when I had my first pellet, I was like, I understand how and why men might feel and do some of the things. Because I was like, if I'm walking around feeling like this with this kind of testosterone, it's like, yeah. So I may have said that before. I think I forgave every man that cheated on me, because I was just like, well, if you're feeling like this, I can't even say I blame you. I tell patients, if you're going to take pellets, you need to have an outlet. Got to be ready. But pellets aren't the only way, but they're definitely a way to get a kind of boost of your testosterone. Why does conventional medicine not like pellets? Well, first of all, it's not as easy. We're going to get higher testosterone levels than what we think. We don't really know what higher testosterone levels do. There's no science around it. Nobody's really studied it. Nobody studied higher testosterone levels really in women and the long-term impact of that. But we do know that there's average ranges of testosterone. And if you do take a pellet, on average, your testosterone levels are going to be higher. But even if you take troches or creams, your testosterone levels can likely get outside of the range of what we consider normal. But I would argue that I'm not sure we really know what normal testosterone levels are or what optimal testosterone levels are for women and whether that's a good or a bad. And again, I never tell a patient to start with a pellet. I always say start with, the conventional way to take this medication, and then we can evaluate this if you're still feeling like you want a little bit more boost. But in general, testosterone is definitely going to be a good tool for you to consider in terms if you're trying to increase libido. I tell people all the time, you cannot override a bad relationship with testosterone. So if you don't like your partner, if they're not pushing the right buttons, if you're not getting your needs met, then it's, this doesn't always work. Estrogen, for a number of reasons, can increase your libido, but also it can definitely be very helpful for, just vaginal health in general. There are suppositories that I've actually started selling in the office. The one company is called Pacific Roots. They have a CBD, and then they have a CBD with a tiny bit of THC. Like, it's so little THC that they can sell it. Like, it's not, you don't have to go to a dispensary to get it or anything like that. And you're not going to feel any type of kind of way, but it's suppositories that are placed in. And so what we know is that CBD, THC, through these chemicals can also increase vasodilation. That vasodilation increases blood supply. What does that blood supply do? That's going to increase pleasure. At the end of the day, that's what we're trying to do, is to increase nerve sensation, increase blood supply. Although we don't know how much THC is safe, anywhere from maybe 3 to 5 to 10 milligrams max probably is going to help be more inhibitory in terms of the brain, so that we can turn off the thinking, so that we can relax, so that allows us to even experience more pleasure. So it's also our brain being able to be turned off, but also, for some, depending on the strain and the amount, they may just experience more pleasure. That's why you might love the way food tastes so much better. Music just sounds so much better. You can feel more sensual. So again, not saying these are necessarily recommended ways, but I know that these are ways that have been helpful for lots of people. And the vaginal rejuvenation, that has been a game changer for a lot of patients. Basically doing things to stimulate blood supply to wake that area back up. I've had patients who've had the procedure and been like, it was like I just reconnected my brain to my lady parts again. It was like, just kind of stop feeling things down there. So we got to figure out how we're going to feel things again. So shockwave therapy, radio frequency heat that's going to increase collagen, increase blood supply. All of these things can be helpful. And this is, for those of you who are just interested in really taking it kind of to the next level. It's definitely not for everyone, but there are some things out there. If you're struggling, you do not have to suffer. You do not have to be on the struggle bus when it comes to this. There are definitely therapies and things out there. So check us out at Tula Wellness if you're interested, and we can talk to you more about what that looks like. And basically, this is a lifelong journey. It's going to evolve, but it never is going to disappear. You got to keep communicating. You got to keep the connection between your partner. You got to be curious and just try to look at this, not through the eyes of it's automatically going to go downhill, but through the eyes of how can I really make this better? Because it really can. And it really does require you, again, to really start to learn, like, what are those areas of your body that really can be aroused that also help. One thing I didn't mention, I do want to close with, and I'm actually on my way to ISHWISH, which is the International Society for the Study of Women's Sexual Health. It's one of my favorite conferences. And last year when I was there, it was a really great lecture where I got to see somebody had done some work looking at the way the brain responds with clitoral stimulation, vaginal stimulation, versus nipple stimulation. And the same receptors when it comes to basically working towards a climax were aroused with nipple stimulation. And so just know that sometimes, it's not just about the vaginal stimulation. Maybe it requires some dual stimulation, and understanding that for some women, nipple stimulation is as significant as anything else. That's why, looking at movies and the media in terms of how we get there is really kind of off, because there's so many different paths to how you can get there. And you got to figure out what your path is. Maybe your path changed as you've aged. You're not the same person. You don't have the same body, but it's time to maybe even explore what do those other areas look like. So as usual, stay beautiful, stay brilliant, and Stay juicy. I'm your host, Dr. Ariana, and I will see you on the next one.